I'm your host, Taylor, an occupational therapist passionate about sharing valuable insights and inspiring listeners on the power of occupation. Get ready to expand your knowledge, challenge your perspectives, and be inspired by the stories of resilience, determination, and success. I am beyond stoked for today's topic. It is all about aquatic therapy. All about, I guess, is a loose term because we can only cover so much in one podcast session. But if you've been stuck in a room with me or have even mentioned the use of the pool, I'm so sorry because I probably word vomited about how awesome the pool is. It's truly one of my favorite interventions. As a disclaimer, of course, anything that I talk about is not meant to be taken as medical advice, just my reflections, and I strongly recommend having a mentor if you're going to use the pool or at least getting some courses under your belt before diving in. No, but truthfully, I wish more people would use the pool. I've found in talking to folks that most people are afraid of it or they don't truly feel equipped to utilize the pool just because of a lack of knowledge or lack of experience, which truthfully, that's probably really good clinical judgment. I mean, I know myself, I first learned about aquatic therapy when I was a level 2 student. My CI at the time was an OT and a PT, and she is literally the GOAT. I actually talked about her a bit in our last podcast with Luke, but she is one of my good friends now and is the GOAT. So Lindsay, if you're listening, you're the real one. Lindsay had a fair number of people on her caseload that she saw in the pool, and she would also see them on land. But what was super cool is while I was learning from her, she was actually in the process of getting her Aquaticist certification. So it was super cool to learn, more from her as she was going through the process and of course the different ways that we can use the water to support independence and attainment of people's goals when they're on land. So if you've been in the pool, if you've been in a body of water, it's like being in outer space. You've got this whole anti-gravity environment that allows your body to move differently and perform differently. And when we put our clients into the pool, it allows them to maybe do things that they didn't know they could do. Or maybe I, as a clinician, didn't know they could do until they were in an environment that set them up for success. So we're just ever so briefly going to look over some key properties of the water that are super helpful when we're looking at aquatic therapy. One of the first ones is buoyancy. So buoyancy are forces acting in opposite directions of gravity. So it's basically body weight support when you're in the pool. When you're doing that, it helps support muscles that are weak. Buoyancy helps with handling somebody. I mean, just think, I could literally lift 1,000,000 pounds, probably not that much, but I could lift a lot in the pool compared to when I was on land where I have to work against gravity a lot more. It also is super helpful in reducing fear of falls, which is very common with a lot of our clients as they're getting used to their body. I always tell people, worst case scenario, if you fall, you're going to get wet. All right, that's buoyancy. The other one, and one of the top reasons I'll put people in the pool for various reasons, of course, is hydrostatic pressure. This is the force that's exerted on the body as it's immersed into the water. With, of course, the greatest amount of pressure is going to be at your feet. And I posted a reel today about this just as a fun fact. But when you are immersed in 4 feet of water, it's actually the equivalent of wearing 70 millimeters of mercury compression stockings, which is so cool. And we'll talk more about kind of those benefits later, but ever so briefly, helps with decreasing pain, decreasing edema and swelling, increasing circulation, decreasing heart rate, increasing blood pressure. So there's a lot of additional health benefits. And again, we'll talk more, but you have to be mindful how those properties of water might be negatively affecting somebody depending on where they're at in their recovery. Last little bit is resistance. So resistance, we're looking at the viscosity and the drag forces of the water. These are things that are going to help with affecting muscle tone and balance, and allows us to add a little bit of extra resistance training when we're in the pool to really challenge the people that we're working with in a different way. Honestly, probably like 7 more properties of water that we could talk about. But for now, we're just going to leave it at that because this is meant to be, an overview. People always ask me, and it was one of my questions too, honestly, do you need to be a certified aquaticist in order to use the pool? The answer is no. So the pool is considered a modality just like you would use electrical stimulation or, temperature to help facilitate function in the person's goals. That being said, though, you do need to have a doctor's order and clearance in order to treat somebody in the pool, because as much as I would love to have literally every person go in the pool unfortunately does not work for everybody. There are precautions and contraindications for putting somebody in the pool, and a lot of times, they could be different depending on where you're working. Every facility might have their own rules about who can or cannot go in the pool. Like some places, if they have a G-tube, they can't, but other places they can. If they have a trach, they can't, and other places they can. So there's a lot of information that you will need to read up on if you're considering the pool. And again, this is not a teach you how to go in the pool podcast. This is just kind of a brief overview and things to consider if you are wanting to use the pool with somebody. So like I said before, you need to have clearance by a doctor in order to put somebody in the pool. It's a wet, humid environment. There's some reasons why the pool might not be appropriate for somebody. So some precautions that you might look out for: autonomic dysreflexia. That is a very serious medical condition that, people with spinal cord injuries are more susceptible to. Other things: orthostatic hypotension. Maybe somebody has hydrophobia, a fear of water. If they're sensitive to heat, humidity, there is a standard temperature of the water. However, depending on how easily fatigued somebody comes, or if we're working with somebody with neurodegenerative conditions, we would decrease temperature of the pool from that standard number in order to help them therapeutically and, not invoke some type of negative response or trigger. Again, precautions and contraindications. So precautions are things to look out for. Contraindications are like an absolutely hard no. So these are the ones that are going to be set up more oftentimes than not by your facility. And that's just for the safety of your client and the people that you're treating. And it's important to be mindful of those things. So some things to be mindful of, are there uncontrolled seizures? Is there incontinence? Any open wounds? Like I mentioned before, trachs versus G-tubes, DVTs. If someone has a DVT, you definitely don't want to put them in the pool, because we're going to be putting pressure on the body, and that could cause, the clot to come loose and do unfortunate things. Another thing that people may not think about, I talked about fear of water before, but if somebody has poor cognition or if they're super combative, it might not be the safest thing to do to put them in the pool. So those are things to keep in mind. Always, always, always. Again, I will probably repeat this 5 times in this podcast. This is not a teach you how to go in the water podcast. This is a educational resource. Check with your facility, know their guidelines, because it is going to be different. I have seen people with G-tubes in the pool, but some facilities don't allow for that. So triple check and make sure you have crossed your T's and dot your I's, because as fun as the pool is, it is actually a very serious, risky environment to be treating somebody in, truthfully. Past the serious stuff there, the aquatic environment, just some things that it is great for that I haven't overly mentioned before: increasing range of motion, providing proprioceptive feedback. After looking at the different medical complexities of the person that you're working with, there's pretty much any age or diagnosis that would benefit from the pool. Again, pending physician clearance on getting in the pool. If you're like, okay, pool sounds super cool, I'm a little intimidated, I want to get certified, there's a couple different ways that you can get a certification. Right now, there's only 2 ways that I know of getting certified as an aquaticist, and pretty much anybody that is a licensed and certified professional can get the certification. So whether you're a CODA, OT, PTA, PT, SLP even, yes, my speechy friends, you too can be aquaticists or aquatic certification. Now, we're going to dive into 2 different things and why I chose what I chose. Again, this is my own experience, and it's not an endorsement of either one of these, but I definitely encourage you to make an educated decision based on your learning preferences and learning styles. So the first way to get certified is through the Aquatic Therapy and Rehab Institute, known as ATRI. With ATRI, you have to do about 15 hours prerequisite of CEUs in aquatic therapy specifically. Once you do that, there is a 100 question multiple choice test that you have to get a 75% or higher to pass. And the exam fee for that is $225. So depending on when you get your CEUs, there's, it could take a month or so in order to get the certification. With this certification, it's good for 1 year and you have to pay a renewal fee. And I don't remember off the top of my head what that renewal fee is every year. but you also have to get 10 CEUs through ATRI specifically, and they have a lot of online courses that are available for that CEU match. Other option is through Aquatic Therapy University. So this one is more hands-on compared to ATRI, and there are a couple of different tracks that you can take depending on your interests. So you could do a generalist track, you can do a pediatric track, ortho, geriatrics, and then there's supplemental courses depending on which track you decide to do. Each track ultimately breaks down to about 6 classes that are each 2 days of hands-on learning on the land and in the pool. And it does take a little bit longer to get the certification just because of the frequency of when the classes are available. So I think online it says anywhere from 2 to 5 years. And I know for myself, this is where I'm getting my certification through. I'm going on 1.5 years and I have 2 classes left to take. Each course through ATU is around $400, so it's definitely more of an upfront investment, but there is no final test. They test competency throughout each of the courses. And then once you get certified, it's a lifelong. You don't have to do any renewals, any tests, or anything like that. Because I'm a hands-on learner and, after weighing the cost long-term, I personally chose to get certified through ATU because long-term it would actually be cheaper. Even though you don't have to be certified to use the pool as a modality, aquatics in and of itself is a specialization, just like getting your CHT, your, lymphedema certification, NDT, neuroIFRA, the whole 9 yards. So there is a level of investment for the certification. So it's not just something you can pop along and take after a 15-minute, review. But even though there is that cost, I always encourage people to check with your workplace to see if there's, CEU reimbursement money for these courses, or sometimes even organizations will pay for the full certification if they find that it's going to benefit the facility itself. So it never hurts to ask, but I will put a link to both of these websites in the About section of the podcast so that you can continue on and do your own research. The last thing I want to touch on, though, for those who like being in the pool, is taking care of yourself as a clinician while you're in the pool also. We briefly went over some of the properties of the water itself and how our clients can be impacted, but remember, you will also be feeling those same effects. The standard temperature for pools is typically around 94 degrees when you're doing aquatic therapy, so heat exhaustion and dehydration are such a big factor, not to mention the smell of chlorine if you're in that type of pool. And if you're in an indoor pool with the smell of chlorine, you can get headaches. So it's just things to be mindful of for yourself and your client. You want to make sure you're properly hydrating and eating before and after the fact. Again, it's like my rule basically is if I'm going to take somebody in the pool is they have to drink a lot of water and make sure that they are getting enough intake to support them. And, if you ever notice when you're in the pool, as soon as you get out, you immediately have to pee, and you can thank the hydrostatic pressure for that. Go back to 4 feet of water immersion. It's about 70 millimeters of mercury of compression stockings. So that's pushing a lot of fluid up to our bladder. So medically, think of the implications of that. And then also with hydrostatic pressure, we talked about the impacts of that on fluid, but also remember that hydrostatic pressure is proprioception, which is deep pressure. And so when you're in 4 feet of water, that's roughly 1.74 pounds per square inch of deep pressure on your body. And we know that deep pressure has a lot of really good benefits, but one of the big ones being, calming and relaxation. Having that much force on your body will actually make you very tired and very exhausted yourself as an individual, let alone after you're doing these workouts, and also for your clients as well. So again, keep that in the back of your mind when you're thinking about using the pool with somebody. So that is the really quick overview of aquatic therapy. I feel like I burned through that super fast. I strongly encourage you guys to pair up with somebody who does aquatic therapy, even if it's, no one ever really wants to do stuff outside of their own time. But if you're a student, ask if there's aquatics at your fieldwork site and see if you could go and shadow them for a day. If you're a clinician, see if there's somebody in your area, I'm sure there is, that does aquatic therapy, and see if you can just observe a treatment and see how they do what they do. And of course, if you're looking to pursue aquatic therapy as a certification, there's always those 2 websites that you can check out based on your learning needs and preferences. So that's a little quick bit on aquatic therapy. If you have any other questions, just let me know, or if we need to make a part 2 on this pool podcast. If you've enjoyed our discussions and want to stay connected, be sure to subscribe. I'd love to hear your thoughts, ideas, and suggestions for future episodes. Thank you for being a part of this community, and until next time, stay curious, stay inspired, and keep embracing the power of occupation and making a positive impact in the lives of those around you.